Sustaining high-quality patient outcomes relies on dynamic, energetic, and dedicated groups of nursing professionals who prioritize teamwork.
Give your medical surgical unit the recognition it deserves by applying for the AMSN Premier Recognition in the Specialty of Med-Surg or PRISM Award.
Award-worthy units exemplify excellence as they go beyond the standards to provide exceptional patient care.
PRISM Award applications are accepted year-round, and designation to those awarded is valid for 3 years.
To learn more and start the application process, please visit amsn.org.
Or check out the link in our show notes.
On this episode of Med-Surg Moments,
We had my son's 10th birthday party, so we did it at the trampoline park, which was
One of the new grads I hired several years ago, right before COVID, actually got Nurse of the Year.
I am so stressed between my new job and wedding.
I am a total workaholic, and I don't know why, except for the fact that I love it.
We actually had a person come and play electric guitar in the clinic today.
our topic today is the infection we can't afford to miss. Clostridioides difficile, or C. diff for short, is more than just another isolation.
How do you approach it?
Protect yourself and protect the spread of it on the unit, because that can spread.
How do we protect ourselves and prevent the spread and provide care?
Do you guys find that with patients that experience shame and embarrassment around it?
I'm a nurse, I see poop all the time, but there is so much shame around diarrhea, and I'm not sure.
Just for the record, Haley, I am not desensitized. I'm still very sensitized around it.
one time one patient had an accident all over the floor. So as I was cleaning up, and I was like, you know what?
So do you guys have a safety brief every day in your hospital that you talk about C. diff and stuff?
Do they remain on the isolation precautions the entire time they're there?
I want to hear what your biggest takeaways were from this conversation. I'll start.
This is Marcela.
Eric?
Trish.
Kellye.
Sydney.
And Haley, welcome to Med-Surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud Med-Surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
Our topic today is the infection we can't afford to miss. But before we get started, let's begin with some personal updates. Kellye, why don't you get us started?
Sure, Haley. So for me, we had my son's 10th birthday party. So we did it at the trampoline park, which was amazing. He invited all of his new friends. He's had some different friendships over the course of the year, so that has been different. So it was nice to get a chance to meet the parents and form new relationships and set up some play dates. So just excited about that because my son is extremely shy. So it was nice to see Cameron out of his element and just enjoying himself. So we had a good time with that. Another personal update for me is getting ready for baby girl's birthday. She's the next one, turning 9. So we have a lot of birthdays going on over the past 2 months. So just getting geared up for that. And then on this Nurse for the Nurse Week, I wanted to let you all know that I had the honor to be a guest speaker at Southern Crescent Technical College pinning ceremony. So that was a shocker. It was amazing. I was extremely nervous at first. Of course, I told them about our podcast. And after that, just really relating to them, really giving them some words of wisdom, words of advice. I had a couple people in the audience crying, but it was just a really great opportunity to be a speaker at their pinning ceremony, kind of like a full circle moment. What about you, Trish?
Hey, I had a really exciting update about Nurses Week myself. One of the new grads I hired several years ago, right before COVID, actually got Nurse of the Year. It was amazing. It not only gave me chills and made me cry, but she is now just completed her master's degree. She's doing amazing. She never thought she wanted to go on to school. And one of the healthcare techs that I hired, she's in school for her nursing degree, and she got Healthcare Tech of the Year. So that was just super. We surprised them this morning at 7 a.m. to let them know that. So that was just super terrific. Another thing for me is my new granddaughter I told you guys about last time. I got to keep her not only for a short time, but for the weekend. And that was great. Lots of snuggles. We kind of stayed up together and that was just amazing. So how about you, Sydney? What's going on with you?
Trish, you're going to be a little disappointed by my update because I've got about 2 weeks left of my pharmacology class that I'm taking right now for my master's. And then I'm going to take a break. I am so stressed between my new job and wedding planning and just all the things that are day-to-day life. Something's got to give. And I think school is just it right now, which is fine. I know I can always pick it back up and it's always going to be there. But just this class, oh my gosh, y'all, it's killing me. It's not even just that master's degree is going to be challenging, but it's every week a 20-page paper, different case studies and all kinds of things. And I'm learning a ton, which is great, but the wedding's coming up in a couple months, so I just need a break at least for a little bit. So when I pick school back up, I'll let you guys know. But as of right now, I think that's going to be on pause. But other than that, we've had a really fun nurses week so far at my clinic. We actually had a person come and play electric guitar in the clinic today for music for the nurses and the patients and stuff. And we've done that in the past. I have a pianist come, and that was really well received. And so today we had a guitarist come, and everyone's really seemed to enjoy it. So it's actually something we might try to do on like a quarterly basis, just to kind of boost morale and shake things up in the clinic every once in a while. So that's something we're going to explore in the future. And then we have a luncheon tomorrow with all the nurses, just kind of hang out and eat and talk and things and, get away from our desks and hang out. So I'm really looking forward to that. Eric, what about you?
Hi, everyone. Sydney, I want to say congratulations on putting yourself first and tending to your own needs. Don't feel pressured from anyone. That's wonderful to hear. And in solidarity with Sydney, I feel like I should take a step back and stop school for some time. No, I'm just kidding. My personal and professional updates this time are kind of together. You know what I've decided? I am a total workaholic, and I don't know why, except for the fact that I love it. And it's not due to burnout, which I keep having to say, but I've decided to step back a little bit from work and kind of just work what's required and take some more time for me. So I kind of took a little step back, and I'm not staying late or pulling doubles or answering every single short call and going in. I'm trying to take a little more time at home and just feel the earth again. So this past week, I took a couple days off and I did some gardening, and it was so therapeutic. I mean, it was hard work, and I was pulling probably 3 years of weeds, and I was sifting the dirt, and then I went to the store and bought some plants, and I just sat there and just said, and it was so nice. So that's kind of where I'm at right now. Right now, I'm just at finding a peaceful spot for myself. And I want to say, everyone out there listening and all of y'all here, happy Nurses Week. We are always grateful for everything we have, even if some of us don't have anything at our facilities. Haley, what's going on with you?
Before I start with my update, I just want to say how excited I am that you're getting into gardening, Eric. I love gardening.
Gardening's great.
For me personally, I've had a beautiful, beautiful Nurses Week. Yesterday afternoon, I got to be celebrated as one of Delaware's top nurses for 2026. So we had a nice little gathering all together, got to hang out with some friends from work, got to talk to our chief nursing officer. It was so much fun. And Delaware's pretty small. There's 4 or 5 big hospitals, but it's nice to hang out with people that you haven't seen in a long time. And then personally, I had my first trip to the beach last weekend. It was still a little breezy. It was like 60s, a little rainy, a little windy. Not ideal beach weather, but my son was still in his cast anyway, so we weren't actually going to hit the beach. We just did some boardwalk walk time. And that'll bring us right into our topic, the infection we can't afford to miss. If you've spent any time in Med-Surg, you know Clostridioides difficile, or C. diff for short, is more than just another isolation precaution. It's a serious, highly contagious infection that can quickly impact patient outcomes, workflow, and unit safety. From frequent diarrhea and dehydration to strict contact precautions, caring for patients with C. diff requires constant vigilance and team coordination. But the big challenge is how we can help prevent spread while still providing compassionate care to our patients. Who wants to get this conversation started?
Well, at our hospital, that used to really scare me, I have to tell you that. And we were really not very good at it at all. And my nurses would not think very much of it. And it was a subject we really had to tackle. And we had to take a lot of different steps before we had any kind of standardized process for it. So we have a very good bundle process for it now, but it took us a long time. What do you guys do for your C. diff as far as how do you approach it?
I think those bundles, like you mentioned, are really helpful. One of my facilities I worked at, we had specific bundles for airborne versus contact. We had really good door signs that we used to place. They would have little pictures with reminders, the little thing of the bleach wipes and exactly pictures of what you needed to wear. And I think that was really helpful to have a visual. You see a yellow sign on the door and you're just like, nah, whatever, but I just need to go in for a second. Then you see like the bleach wipe or the yellow gown or whatever else was on there. And it's like, oh, yeah, but I need to put that on. Or like, oh, I need to make sure that those wipes are in there. So I think those bundles are super helpful reminders when taking care of those patients, exactly how to protect yourself and protect the spread of it on the unit, because that can spread really quickly.
Do y'all have those floor stickers as well?
No.
No? Oh, we have giant stickers that go on the floor of the patient's door, and it's one way says, gown up before you go in. And when you leave, it says, wash your hands with soap and water before leaving.
We don't have the floor ones, Eric. We have the sign on the door, and we have the one that goes over the hand sanitizer. And then we have the one for the bathroom door. We have the one before you ever put the patient on precautions. It's the whole stop and think about this. And then it's in Epic, it's the one that triggers you. And even the one for the doc that says, think about this. It's like the whole process, but we've gone in varying steps.
Are you talking about precautionary signs?
Mm-hmm.
Oh, okay.
Like the one for the doctor came last, but it's the one for our supply carts. They were handmade by our volunteers at first, and now they're made by our supply distribution folks. Now it's like a finely tuned process that are automatically made up, but it's taken a long time to get there. But before you grab one in the supply cart, it's got the thing that says, okay, stop and think about this before, does this patient qualify for the C. diff bundle? And you have to check off the whole C. diff thing. But we don't have the one for the floor, so tell us about that.
It's a big sticker that goes on the floor. And it says one way you gown up and the other way it says wash your hands. It's not anything revolutionary. It's just a big visual. It's helpful.
Yeah, we don't have one for the floor.
How do we protect ourselves and prevent the spread and provide care? I think it's kind of like broken up into little pieces, because when I think of preventing the spread, we all know, or we should know, the precautions and what we do. But what we deal with in our facility is patient visitors and family. The ones that don't gown up, the ones that don't understand, the ones that don't wash their hands, or they come out in the halls wearing their gowns and touching everything. That's one of the biggest things we have to deal with.
Yeah, we do it, but we just don't have anything that goes on the actual floor. Ours goes on the patient door and the hand sanitizer because you want soap and water. We put it on the bathroom floor because you don't want any visitors using the bathroom. So it sounds like we're doing kind of the same thing, but we don't put it on the floor.
Yes, understand, Trish. My facility doesn't provide anything on the floor to answer your question. But I was going to say, Eric was talking about, we do have a lot of trouble with keeping family members out of the rooms, and they wouldn't gown and glove, and they would just go into the rooms thinking everything was okay, touching surfaces. So it was a lot of patient education involved. So we tried to come up with having C. diff super users. This was my old facility. They used to try to come up with teams to have super users on the unit. So at bedside shift report, whenever we're doing that in morning huddles, if we had C. diff patients on the floor, the charge nurses would identify those C. diff rooms, and then we would have a lot of education in that huddle and just reminders. Sometimes infection preventionists would come on the floors and just kind of round on the nurses to let them know, hey, remember to educate your patients about family. Remember to educate your patients about gowning and gloving and limit the family members' visits. They would understand the why behind why they need to gown and glove when visiting family members. We would have a lot of trouble with that as well. So just being creative, coming up with your charge nurses, infection preventionists, having super users on the floor just to kind of help with that education.
One thing we did, Kellye, is we have bleach spray bottles and we kind of spray the visitors as they leave the room. Wash your hands.
That would work too.
Yeah.
I've been very surprised over the years of how many adults that I have to teach how to wash their hands properly for the correct amount of time and with actual soap and not just water.
Do you guys find with C. diff patients, and I think we've touched on this with patients on all kinds of precautions and things, but that they experience any sort of shame or embarrassment when they're on all the precautions and things? Because I remember having patients specifically that they come in with the gown and you're wiping everything down and you don't want to touch anything, and then you're washing your hands. And they said, they're like, am I that dirty? And it took a lot of also education, but just explaining with them that it wasn't them, it's the disease and the infection, and we're just trying to keep everyone safe. But do you guys find that with patients that experience shame and embarrassment around it?
I see a lot of people with embarrassment around diarrhea in general. Everybody poops. I actually read that to my son just 30 minutes ago. Everybody poops. Not a big deal. I'm a nurse. I see poop all the time. But there is so much shame around diarrhea, and I'm not sure if I understand it.
I agree with that. They're like, oh my gosh, I've had diarrhea now for several days. And especially if they're of a younger age, they're very embarrassed about that.
Yeah. And maybe as nurses, we're just kind of desensitized to it because we talk about stool patterns all the time. But there's so much shame around talking about stool. I mean, we talk about it as nurses. We can talk about it over lunch and we don't really have a second thought about it.
Just for the record, Haley, I am not desensitized. I'm still very sensitized around it.
I talk about diarrhea like it's my job, which it is.
You do talk about it.
I do. Unfortunately, I feel like I spend 70% of my workday talking about C. diff in particular.
Just the bodily functions cause embarrassment, things you do in private. So imagine when someone's weak or incontinent and they need help or they're ashamed. I've had patients that won't speak up when they have an accident because they're too ashamed of it.
Yeah, I think that's a big part of it too, is the people that can't get out of bed, can't clean themselves up. It's one thing when, you're fully functional and you're at home and you eat something bad and you're just on the toilet overnight. But when you're not used to having to ask for help with those types of things and then having a nurse come in and have to change your sheets and wipe you, and then they're in all the gear and everything, I can understand how that would feel embarrassing and feel isolating for sure.
Yeah.
A lot of times I have to just kind of make light sometimes of situations, and I know that may sound a little difficult, but bringing in, when I precept my new nurses and things like that, I would say, okay, this patient has C. diff. We'll debrief outside, let them know a little bit about the scenario. We'll go in and we'll say, hey, Mr. Brown.
Kellye, did you pick Mr. Brown because it's C. diff?
Yes. Mr. Brown, I understand this is going on with you. You have C. diff. The reason you're having a lot of bowel movements is because of this process and this bacteria and things like that. And I'll say, anytime you have a bowel movement or you go, I need to know, because I need to know how often you're going so I can report it to the physicians, and we need to monitor your fluid and electrolytes, and we need to make sure you're staying hydrated, and we need to replace your potassium. So the more and more I talk about it and let them know what to expect and what can happen if your body is depleted. One time, one patient had an accident all over the floor. So as I was cleaning up, and I was like, you know what, Mr. Brown, this is nothing to be embarrassed about. This is going to happen. We are here to help you. We're here to help you get through this situation. That's why we have the antibiotics. That's why we know what to do. We're protecting ourselves. We're protecting you. So just talking the patient through it, making light of the situation, I think that helps Mr. Brown a whole lot.
So do you guys have safety brief every day in your hospital that you talk about C. diff and stuff? How many C. diff orders you have, anything like that?
Yeah, mostly with the charge nurses, they'll go to
Yep.
their meetings and then they'll have those discussions about how many C. diff patients there are, have infection preventionists round,
Yeah.
see the time frame they came into the hospital,
Yeah.
how many bowel movements they actually had, just really educating PCTs and nurses to please document how many times they had bowel movements, because this is very, very important. Sometimes they'll put on these precautions for days and days, and no one is ever assessing and checking to see how many bowel movements has been had. You go through patients' charts sometime with C. diff, and the doctors are like, Mr. Brown hasn't had a bowel movement in 5 days, so why are we still having him on C. diff precaution? Things like that. So yes,
Yeah.
you have to do those extra checks.
Yeah.
Definitely.
Exactly. Yeah, because we don't want unnecessary testing, because then we're getting false positives. We're isolating people inappropriately. We are giving them antibiotics that they shouldn't be having regardless.
My point about the doctor and ordering and all that stuff.
Yeah. And C. diff cases are one of the toughest of the nursing sensitive indicators, because although it is a nursing sensitive indicator, it is so multidisciplinary, where physicians are prescribing antibiotics or PPIs or holding off on probiotics, and then patients develop infections and we're like, who are we going to point the finger at? And unfortunately, it always feels like it comes back on nursing, regardless whose actual fault it is.
And then there's some of those patients that have been in the ICU for all those days, and they really do end up with that C. diff.
It's like, could we have prevented it? Maybe, possibly, but we don't have the magic globe to look back on to see what exactly was the lapse and what caused the microbiome to malfunction.
Right. It's hard.
It is hard.
Every time I give the oral Vanco, it always smells so good. It smells like grape. And everyone always says it's the worst tasting thing. And I've always wanted to taste it.
I've never had the privilege. I have been tempted to try lactulose, though, because it smells so good.
I know.
Lactose smells so good.
I think it smells so good, like snow cone syrup.
I've had liquid doxy. That tastes good.
You have had that?
I have trouble swallowing pills, so I had to ask for it, and my pharmacy was not very happy with me. But they did it.
I bet that's not that easy to come by, though, probably for them.
No, I had to go to a different pharmacy than my usual.
That's what I was guessing.
So Haley, at your facility, if a patient has been tested positive for C. diff and treated, do they remain on the isolation precautions the entire time they're there?
So at our facility, we do not do that. We have them complete their treatment, and then they have to remain diarrhea-free for, I believe it's 48 hours. So at least 10 days of treatment, and then diarrhea-free for 48 hours. And then we discontinue their isolation. But before we discontinue their isolation, we move them to a clean room, and then we do an official discharge clean on their room, completely bleach wiping everything down. We UV light the room to kill the spores, and that way we're not cross-contaminating again by not cleaning their room properly and discontinuing isolation.
Or stay on isolation the entire time they're there? Following treatment, once they're there, they just remain on it.
Do you think that's been beneficial for your organization from a C. diff level perspective, or do you think that it's been creating unnecessary isolation?
The latter. I always think, what does it come down to? And I always think it's always got to come down to the money. It's always got to come down to the dollar. What's more cost efficient? Because, they don't want to retest them.
Exactly.
They don't want anything like that. I love that you guys basically put them in a new room and deep clean the old room. I think that's great.
Exactly. And
They're not-
all of their belongings, and who knows what's in their belongings.
And people, like I said, people that come and go, so you could just be recontaminating everything. I think that's a great thing that you guys do, but we just keep them in there forever. It's isolating, like you said. It's not just that, but they don't leave the room. They don't wander the halls or walk around. So they're just permanently shut in from everything else.
So we've now learned there's a variety in how facilities handle that, right? As we learn, there's a variety in how our bundles and our different ways of handling the initial stay of C. diff rule out type situation.
Variety of stickers on the wall, on the floor.
I love that moment when I became a nurse and I learned I could tell when someone's C. diff positive by the smell. And they're like, oh, no, they don't have C. diff. No, they don't. And you're like, oh, yeah, that's C. diff. They got it. I mean, we'll test them.
The literature says that human beings don't have the capability of detecting it. If you're like a specialty sniff dog, then maybe you can. But I swear, when I go by a C. diff room, I can smell it.
I can definitely sense, smell the smell of C. diff. It is awful. And no matter how many coffee grounds you put around the room, no matter how many times you spray the neutralized air freshener, it doesn't work. Peppermint in the mask doesn't work.
No, it's not awful, Kellye. It's distinct because we're nurses. We're compassionate. It's not awful.
It's definitely not delicious, though.
It's definitely not.
And you know how you try to, especially the new nurses and the healthcare techs, and you try to be so therapeutic. And you're like, oh gosh.
Yeah, there's definitely nothing more demoralizing than hearing somebody outside your room going, oh my gosh, it smells so bad.
What would your words of wisdom be to us, Haley, about caring for the C. diff patient?
I think I want to hear from you guys. I want to hear what your biggest takeaways were from this conversation. I'll start with you, Trish.
My biggest takeaways would be to catch C. diff early and have a standardized process, definitely with catching it and the standardized process within your hospital. That's been the most important thing for us, definitely. How about you, Kellye?
For me, it's definitely the patient education, making sure they understand what are the risks behind family members coming in and out of the rooms, and just really having them understand that, and families. And having backup, sometimes some families give you pushback and things like that, but having a backup if things turn left really quickly, just that education.
And Sydney, what stood out the most for you?
I think I really liked Kellye's perspective for the approach for coming at patients that are dealing with embarrassment and just talking about it, really coming at it from the medical standpoint of, I need to know how much you're going for X, Y, Z, not just like, oh yeah, it's normal, it's okay, you're sick. That's compassionate, but it's not really giving them the full perspective of why we need to know and help them understand it from not oh, I'm embarrassed to tell the nurse. Oh, I need to tell the nurse because it can affect me in other ways. So I thought that was a really good approach to it. So thank you, Kellye, for that.
No problem.
Eric, how about you?
I like that different facilities deal with it in different ways. It gave me some ideas to think about to bring back to my place.
Nurses love education.
And pens, apparently.
Oh, yeah, so definitely. Definitely in pizza. As for me, I think my biggest takeaway was from Eric about the floor signs. That was the one thing that I heard that we haven't implemented at my organization. And we have heard a lot from like a human factors component that people are not looking at the doors as much as you think they would. If the door is already open, then they're not looking at the door before they go in the room. So they might not even know a patient is on contact precautions before they're entering the room. So I thought that was a great takeaway, and I'm excited to bring it back to my C. diff prevention team. And to our listeners, I want to give a big thank you to all of our Med-Surg nurses for doing what they can to help prevent C. diff, prevent the spread of C. diff, and keep our patients safe. So thank you for joining us, and we will see you next time.
We look forward to connecting with you on the next episode of Med-Surg Moments, the AMSN podcast.
In the meantime, we encourage you to subscribe to Med-Surg Moments wherever you listen to podcasts.
To reach us, use hashtag MedSurg Moments on your social post.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We're all AMSN members, and if you love Med-Surg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the Med-Surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Sydney,
Eric,
Trish,
Kellye,
Haley,
and Marcela. And always remember, Med-Surg Moments is a moment in our lives and a moment in our Med-Surg careers that makes a huge difference.